We are starting to see a softening in the pandemic recovery. And yeah, some of it has to do with anti-vaxxers. What has been a fantastic, 80, 85, even 90% recovery from the pandemic, and I mean economically, and I also mean from a public health standpoint, is now slowing down. Now, you might be saying, whoa, hold, David, wait a second. Are you criticizing the state of play in the United States during a Democratic administration? I thought you were a Democratic shill, or a shield, as someone recently called me. No, you guys know, many of you know, I've never been a Democrat. I don't really care about the Democratic Party. I just call things the way they are. And we are now seeing jobless claims up and higher than expected. Initial jobless claims for the week ending July 3rd came in at 373,000 new jobless claims. That's higher than the 350,000 that was expected. Initial unemployment claims had been on the decline, big picture, for months now, but we're now seeing a reversal. Jobless claims going up. Meanwhile, there are broader concerns about the global economic comeback. Anecdotally, Japan has now declared a state of emergency in Tokyo, and COVID cases are surging globally. They're surging in a number of countries and overall, and they're also up a bit, actually close to 20% in the United States. Check out these numbers. Around the world, cases had bottomed out in mid-June at about 360,000 a day. Globally, cases are now up 12% just in the last few weeks to over 400,000 cases a day. This is believed to be mostly because of the more contagious Delta variant. Sometimes people see something on the news, more contagious Delta variant. That doesn't really mean anything. No, we are seeing, because it spreads more easily, 12% more cases globally per day. There's now an even more contagious Lambda variant. We don't yet know much about it, which could be the next to spread and become dominant. So cases up 12% globally. In the United States, cases are up 20%. We had gotten down to about 12,000 cases a day in the U.S. We are now up to more than 14,000 cases a day in the U.S. That is a big jump. Now, so far, fortunately, we are not seeing higher deaths. But remember that deaths lag cases by weeks. The hope would be, the optimistic scenario is, even though we're seeing more cases because Delta's more contagious, if you're vaccinated, you still are unlikely to get hospitalized if you get the virus, and you're unlikely to die if you get the virus, if you are vaccinated. That's the hope. We don't really know that yet. We need another 3 to 4 weeks to see if that's the case. And meanwhile, 20% of Americans still don't want the vaccine. If you care about public health, you would go and you would get the vaccine. If you care about the economy, you would go and you would get the vaccine. If you care about avoiding another sort of shutdown to some degree in the fall, you would go and you get the vaccine. What are we doing here? Let's put up this pathetic chart of U.S. vaccinations per day, and you will see, if you were watching today, that we are basically down to the level of daily vaccination that we saw in January. Now, think back to that, okay? In January, we had almost no vaccines. It was healthcare workers, and I think we were starting to make the vaccine available to the oldest and most vulnerable. We are vaccinating the same amount of people now when we have full availability. You just walk in many places, you don't even need an appointment, you just get vaccinated. And somehow we are vaccinating no more people over the last week than we were doing in mid-January, when availability was close to, not literally zero, but it was very, very low. And in other countries, people are just sitting. They're waiting for the privilege of having the vaccine access that we have. And we are seeing it reflected, not just in the case numbers, but in the economic uncertainty as well. And so my appeal is, if you don't care about other people, if you just don't want to get vaccinated because you have assessed that you were at low risk, either accurately or not, and you don't really care about other people or whatever else, do you care about the economy? Because the economy is wrapped up in the success of the public health recovery. Come on, guys. The world is desperate for the vaccines that we have an overflow of. Just go and get vaccinated. Let me know your thoughts on this. Do you think that this will continue to worsen, or is this a temporary blip as we hopefully get closer and closer to herd immunity? Let me know. You can find me on Twitter at Pakman, and we will see. I mean, listen, by 10 days from now, we'll have the answer, and hopefully It is a positive one and not a negative one. For the longest time, I was having trouble finding snacks that are healthy but actually taste great and fill me up and satisfy a craving. And that's why it's great that I stumbled upon Monk Pack and we asked them to be one of our sponsors. Monk Pack Keto Nut and Seed Bars are delicious snacks that have 1 gram of sugar or less, only 2 to 3 grams of net carbs, and just 150 calories, perfect for a keto or low carb diet, or anybody who, like me, just prefers to eat a low sugar diet. I love the Monk Pack Keto Nut and Seed Bars because it's really just a great balance of sweet and salty, soft and chewy, but with a nice crunch from the nuts and seeds. Flavors include caramel or caramel, you tell me, sea salt dark chocolate, and peanut butter dark chocolate. That's my favorite. They'll give you all of your money back if you don't love it. Go to monkpack.com. The link is down below, and they'll give you 20% off any of their products when you use coupon code Pakman.